Mr. President.
Senator from Wisconsin.
Thank you, Mr. President. Across the country, people are experiencing the ramifications and women are feeling the pain of Roe versus Wade being overturned and having lost fundamental rights and freedoms overnight. In my home state of Wisconsin, women are living with dire, real-life consequences. Two constituents, Erica and Scott, have been trying to get pregnant for years, something many Americans can relate to. And finally, they were successful. But 13 weeks into her pregnancy, Erica learned the heartbreaking news that the fetus had a rare condition that caused the skull not to fully develop, and the fetus could not survive. An absolute nightmare for expecting parents. Instead of being able to get immediate care and mourn their loss, Erica and Scott had to figure out the logistics of how to get the health care they needed, an abortion, out of state. Let me say that again. Expecting parents learned that they lost the baby they had tried years to conceive, and instead of being able to mourn their loss, they had to navigate a complicated legal and medical landscape and play travel agent. They had a challenge even to get somebody on the phone and struggled to find an appointment sooner than 2 to 3 weeks out. In the end, Erica was forced to stay pregnant for a week with a fetus that she knew could not survive. She said, "Every day I was still pregnant was just an ongoing reminder of our loss." Sadly, Erica is not alone. One Wisconsin woman bled for more than 10 days from an incomplete miscarriage after emergency room staff said they would not treat her. Another, whose water broke at 17 weeks, was sent home without the abortion care she needed, only to return 2 days later with a life-threatening infection. All of this is because Wisconsinites have really been sent back to the year 1849. And what do I mean by that? In 1849, Wisconsin's one-year-old legislature banned abortion, making it a felony to provide abortion care in almost all circumstances. At the time of the vote, exactly 0 women were present to debate that misguided law, let alone vote for or against it. In fact, it would be 70 years before women even had the right to vote. And yet, 174 years later, an activist Supreme Court ripped away the constitutional rights of millions of Americans. And last year, this abortion ban in Wisconsin that predates the Civil War went back into effect, denying hundreds of thousands of Wisconsinites the right and freedom to control their bodies. This archaic law has doctors and medical professionals afraid to administer the life-saving care they are trained to provide for fear that they might be prosecuted. In fact, lawyers are now deciding what care can and cannot be provided. This law is leaving women with no good options and wondering how in 2023 they could have found themselves in a position with fewer rights than their mothers and their grandmothers. Women who have the means and the ability can seek care out of state, sometimes traveling hundreds of miles and often being forced to take off time from work. Some others are being forced to self-administer medication abortions without medical supervision. Those who cannot afford the cost of travel and lodging, childcare, or time off work a reality for so many Americans, especially women of color and those in rural areas. They are being forced to carry pregnancies that they did not choose. Wisconsinites are not alone, unfortunately. Across the country, 14 other states have already implemented near total bans on abortion, leaving 1 in 3 American women without access to a safe and legal abortion. And anti-choice extremists in states across the country are continuing their crusade. They are continuing to try to take away bodily autonomy by pushing bills that include medically unnecessary restrictions that limit access to abortion care. This all flies in the face of an overwhelming majority of Americans who support women having control over their own bodies and their futures and their families. And that's why I, alongside with a record number of my colleagues, am proud to be leading the introduction of the Women's Health Protection Act. This legislation would protect the right to perform and access abortion care free from arbitrary waiting periods, biased and scientifically inaccurate counseling requirements, mandatory ultrasounds, and absolute bans on abortion earlier in pregnancy. Our legislation makes sure that the life and health of the mother are paramount, just as it was prior to Roe being struck down by the United States Supreme Court, and as the American people overwhelmingly support. The Women's Health Protection Act would return the life-altering decision to have a baby to women and their doctors without interference from politicians. For Wisconsinites like Erica, whose rights and freedoms have been stripped away, this bill is not just a political exercise. It is a necessary response to a very real crisis. Having the freedom to control your health care, your body, and your future, free from government interference, is a fundamental right. But in Wisconsin, it is no longer a reality. It is time to pass the Women's Health Protection Act. Thank you, and I yield back.
Senator from Minnesota.
Madam President, I rise today on International Women's Day in support of the Women's Health Protection Act. I would like to thank Senator Baldwin for her leadership from my neighboring state of Wisconsin, Senator Blumenthal for his longtime leadership of this bill, as well as Senator Murray and so many others, including yourself, Madam President, for your work on this. I also wanted to mention Erin Chapman of our Judiciary team, who's here with me, who's worked on this as well, and my colleague Tina Smith, who is the only senator to have worked at Planned Parenthood in the United States Senate. Last year, the Supreme Court issued a ruling shredding nearly 5 decades of precedent, protecting a woman's right to make her own health care decisions against the wishes of 70 to 80% of Americans who believe this is a decision that should be made between a woman, her family, her doctor. In this past year, we heard that majority loud and clear. In states where access to reproductive health care was directly on the ballot, from Montana and Michigan to Kentucky and Kansas, voters turned out to protect a woman's right to choose. It was almost as if those that authored some of these resolutions, like in Kansas, that tried to limit a woman's right, forgot that women were going to show up and vote. And in Kansas, they did in record numbers right in the middle of the prairie. This doesn't come down to red states or blue states or purple states. As you know, Madam President, this is about freedom. As voters across the country have made clear, it is unacceptable for women to be left at the mercy of a patchwork of state laws governing their ability to access reproductive care, leaving them, as Senator Baldwin just pointed out, with fewer rights than their moms and grandmas. That's right, my daughter has fewer rights right now than her mom and her grandma did. And you think about what's been happening. You think about the heartbreaking story of that 10-year-old girl in Ohio who had to go to Indiana after being a victim of rape and had to go to Indiana just to get her health care. I remember when that story came out, people, including news organizations, some of them said it was a hoax. And then they had to go back. They had to go back and apologize to that little girl because it wasn't a hoax. It really happened. And those are the stories we are sadly seeing across the country. So what can we do in the face of this threat to women's health and freedom? All three branches of government have a responsibility to protect people's rights. And if one branch doesn't do its job, then the other branch is supposed to step in. That is why we are introducing this bill. Congress must act to codify the principles of Roe v. Wade into law, and we have the opportunity and the obligation to do that with the Women's Health Protection Act. We have updated this bill to make clear Congress's intent to restore the rights the Supreme Court took away in the Dobbs decision. The bill also protects a woman's right to travel to another state to receive reproductive health care, something that I know you, Madam President, have been leading on during this past year. All of this comes down to one question, and I will end with this. Who should get to make these personal decisions for women? Women herself or politicians? I think the answer is clear. I do not think that a woman making these decisions want to see our Republican colleagues in the waiting room. That's why I urge every senator to get behind the majority of Americans who support a women's right to choose and support the Women's Health Protection Act. Thank you, Madam President. I yield the floor.
Madam President.
Senator from Vermont.
Thank you. I rise today to express my strong support for the Women's Health Protection Act to restore abortion access to women all across our country. You know, I first want to address what the court did in Dobbs. It's a truly astonishing and tragic decision. What the court did is, for the first time, take away a constitutional right, in this case a right that women had enjoyed to make their own decisions about reproductive choice, something that the court had enshrined in Roe v. Wade. In the whole history of making a more perfect union in this country has been about expanding that we all are created equal, that we all have rights under the law that will be protected. And the Supreme Court, in the Dobbs decision, reversed that, where the court played this destructive role of taking away a constitutional right that our women in this country have enjoyed. The reasoning in that case, referred to by Justice Thomas, suggested that if there wasn't a right that was enumerated very specifically in the Constitution at the time it was written, then that right cannot be protected. It really implies, according to that reasoning, that interracial marriage could be struck down, that contraception should be struck down. So the decision that the court made in Dobbs, and the reasoning in Dobbs, is a real threat to the privacy rights that each and every American enjoys to make decisions about their own autonomy. We have reacted around the country with some states stepping up to protect abortion rights, in other states enacting significant abortion restrictions. So what has happened with the court decision in Dobbs is that we've created this immense division. For 50 years, all the women in this country had a right to make their decision and respect the decision that another woman made. And that might be to terminate a pregnancy, it might be to take that pregnancy to term. But that was an individual decision that the individual woman had to make herself in consultation with whomever it is she chose to consult with. It created the opportunity for unity and for acceptance by respecting the individual nature of that decision and the individual right of that person affected to make that decision, not to have a decision made, as Senator Klobuchar mentioned, by politicians. Now, in Vermont, we voted across the state to constitutionally protect the right of a woman to make her own decision. So we enjoy in Vermont, on a bipartisan basis, something that was supported by our Republican governor as well as all our constitutional officers. We've protected the right of a woman to choose. But when I talk to Vermont women, as happy as they are that Vermont stepped up to protect their right to make their decision, they believe, as I do, that any woman's right should not be based on the zip code that they live in. It should be universal. The Women's Health Protection Act makes the right of every woman in every zip code to make her own personal decision. And by the way, that creates unity because it's not telling a person what decision they should make, it's accepting their right to make the decision and respecting the decision that they make. Now, women have been the leaders in this, and rightly so, because the women in this country have been most affected. But men have a very big responsibility to stand up in solidarity with our women who have to protect, who have a right to protect their own bodily autonomy and to make their decision. What we've seen with this patchwork of laws is not just confusion, but peril and anxiety. It's peril and anxiety for a woman who may run afoul of that state law made by politicians, and it's also created enormous uncertainty and anxiety for our providers who have to navigate whether what is the decision they have to make about providing a service is legal, and whatever decision they make can be challenged by some citizen seeking a bounty to hold that person to account for essentially stepping forward and providing services to a woman that they're entitled to receive. So the Women's Health Protection Act is absolutely essential, both to protect the individual right of that woman to make her own decision, and it's also essential for us to create unity rather than division on something that's so essential, so personal, and so important. So, along with my colleagues who are speaking on behalf of this legislation today, I urge all of our colleagues in the Senate to support this bill and protect and preserve the right of women in this country to make the decision that they deem best for them. I yield back.
Madam President.
Senator from Washington.
Madam President, I join my colleagues this afternoon to come to the floor and speak about the introduction of the Women's Health Protection Act and codifying access to reproductive freedom for women in America. It has been a little over 8 months since a radical Supreme Court overturned 50 years of landmark ruling guaranteeing the right to privacy and the right to obtain an abortion. I want to take this time to highlight the impacts of this decision that it's had not just on our country, but even in my state, in the state of Washington. We in Washington voted in 1991 to codify abortion as a legal right. We did that by a vote of the people. But we still need to worry about this issue because the problems that are causing the erosion of abortion rights in some parts of the United States is even causing hardship in our state. Abortion clinics in Washington are facing rising caseloads and rising costs. Planned Parenthood in Spokane reported that in January, their clinic saw a 75% increase in the number of Idaho patients who are traveling across the line to get abortions. Physicians are rightly concerned that they could be arrested or sued for providing reproductive care to patients from abortion-restrictive states. And pregnant women have it worst of all. If they go to a reproductive clinic for whatever reason, they can face a gauntlet of protesters. Yes, there's protesters right outside the Planned Parenthood clinic in Spokane that they are trying to set up fake clinics with fake names to divert women into their facilities instead of the actual care that they need. I will note that it wasn't that long ago, just a few years ago, that the Planned Parenthood clinic was bombed in Whitman County, just south of Spokane. So these issues are a problem. We even have had healthcare officials tell us that Washingtonians trying to get access to the morning after pill had to go to 4 different pharmacies only to find that it was not available. This drug has been an FDA-approved drug for decades, but all of a sudden in Washington it's not available. Since this ruling was released last summer, 24 states have enacted near total bans or stringent restrictions on the ability to get an abortion. People are still getting pregnant, and they're coming to Washington to exercise that opportunity, and we want to make sure that we have a healthcare system that can deliver. You know, employers are starting to avoid these abortion-restrictive states. I don't know if someone has thought through this issue, but I recently spoke to the co-founder of a very successful aviation company that just had one of the best demonstrations of the future of aviation. They're building a new facility, and he told me point blank he won't even consider locating in a state that doesn't provide reproductive freedom. He said he couldn't imagine having to ask an employee who is enjoying that right in the state that they live in now to transfer to a state where that freedom was lost. He said it's absurd. But we know that people are aggressively trying to restrict access to abortion. They are aggressively pursuing even more anti-choice policies, such as restricting the use of the FDA-approved abortion drug, even though 5.6 million patients in the United States have used that drug successfully since the year 2000. It's plain to see that they're not going to stop, and that is why we are introducing this legislation and continuing the fight and awareness for reproductive health for women in the United States of America. We must put an end to these practices by passing Women's Health Protection Act. We must make this a decision left up to women and their families and allow the future to be decided by them and not the interference of our government. Madam President, I know you know, because you've been a law enforcement officer in the state that you represent, you know the challenges of having the individual's privacies protected. This now is up to us to make sure that we're protecting these rights and protecting women's access to reproductive freedom. I thank the President. I yield the floor.
Madam President,
Senator from New Hampshire.
I'm pleased to be on the floor today with my colleagues, expressing my strong support for protecting women's access to basic health care and reproductive rights. Since the Supreme Court's decision in Dobbs, we have seen our worst fears realized. A wave of abortion bans have been passed by Republican state legislatures and signed by Republican governors. These bans put at risk, as we've heard so eloquently from those who have spoken, the health of women across this country. And we have to look no further than my home state of New Hampshire, where our Republican governor has ensured that women are banned from accessing an abortion after 24 weeks. Our doctors face jail time for helping women access an abortion. Our family planning providers can't make ends meet because elected officials continually block access to federal and state funding that's vital to ensuring that vulnerable populations have access to care. That care includes basic reproductive education, breast cancer screenings, and sexually transmitted disease treatment, all of which are at risk because those family planning clinics are in financial difficulty because the Republican legislature and the Republican governor continue to deny them funding. Just today, Republican representatives in New Hampshire state legislature are considering new abortion bans, bans that are so early that most women don't even know they're pregnant. These bans don't include exceptions even for rape or incest. The Women's Health Protection Act ensures that a woman's access to care is not unnecessarily restricted by where she lives. I want to thank Senators Baldwin and Blumenthal, Senator Murray, and so many others who have been such strong supporters over the years for their leadership in drafting this legislation. I know you know, Madam President, and certainly all women know, that one of the most important personal decisions a woman faces in her lifetime is if and when to start a family. And that decision should be made by a woman, with her family, with her medical provider, and with whoever else she wants to include in that decision. But it should not be made for her by her state representative, by her governor, by a member of Congress, by her president, and certainly not by any unelected jurist. That decision belongs to a woman and a woman alone. It is time for us to restore that right to women all across this country. Thank you, Madam President. I yield the floor.
Madam President,
Senator from Connecticut.
I am proud, but I'm also saddened and angry to be here introducing a measure that should never be necessary in the United States of America. The Women's Health Protection Act will, yes, offer protection to women who need and deserve it, but it is only because of a hideously misguided decision of the United States Supreme Court that we are here today. When I first introduced this measure 10 years ago, the thought of overruling Roe v. Wade was unimaginable. It was a figment of fear, dismissed by realistic scholars and advocates. It was unthinkable. And here we are. The United States Supreme Court has handed down a death sentence to women across America. It has overturned 50 years of precedent, which I know well because I was a law clerk to the United States Supreme Court justice who wrote that opinion in the year afterward. And we thought then, and so did most people in America, we've dealt with this issue, we've disposed of it, it's done in terms of jurisprudence. But this measure is now necessary to protect the rights of all people to seek the health care that they need and deserve. And I'll tell you why I believe that this measure should be passed. I trust women. I trust women to make decisions about their own future. I trust women more than I do elected officials or judges or government bureaucrats to decide what is right for them individually. And this measure is necessary to stop all of the bans, prohibitions, medically unnecessary restrictions that have no purpose except to cut off care and stigmatize women seeking health care services and the dedicated health care providers who serve them. Now, I have a message to the men of America. This fight is yours too. This isn't a women's issue. This is an American issue. It's a family issue. And if you think you are spared the conscience and conviction that should require you to stand up and speak out, you're wrong. This issue is yours too. We've seen horror stories just in the months since Dobbs. You heard one from my colleague, Senator Baldwin. I have a similar one, Amanda Zarowski in Texas, who sadly learned that her baby would not survive, but doctors would not treat her as she might have done in other states. They told her to go home. She almost died. Sepsis. They brought her back to the hospital, rushed her to intensive care, and her husband, Josh, learned that as a result, they might never have children. And he said, quote, "Amanda almost died. That's not pro-life," he said. "Amanda will have challenges having more kids. That's not pro-life," end quote. He called it barbaric. That is the Texas law, barbaric, inhuman. Protecting access to abortion through the Women's Health Protection Act would not only help people like Amanda, women, it would help families. It would help countless people who simply choose access to abortion care because it's right for them and for their families, for other children that are already part of those families. A woman simply should not be forced to carry a pregnancy to term because some government bureaucrat decides she should. There is a kind of dirty little secret here, and that is that Black, Latina, Indigenous, and other people of color have always faced inexcusable inequities in healthcare access and outcomes due to long-standing systematic discrimination and racism and oppression. And the result is that the practical effect of these abortion restrictions and needless requirements fall disproportionately on them and communities of color. This point is so important because it goes to the heart of the Women's Health Protection Act. At its core, this bill is about justice. It's about reproductive justice. It's a term that was conceptualized in 1994 by a group of Black women who rightfully saw an urgent need for a national movement to highlight and focus on the most marginalized women, families, and communities. Abortion bans and restrictions continue to force women in communities of color who don't wish to carry or deny them the care they need and deserve in moments when their health care is at risk. So this bill is critical for communities which are disproportionately harmed by the bans and medically unnecessary restrictions that the Women's Health Protection Act would prohibit. It supports those who face the greatest barriers to care. And I want to finally thank, in this fight, some of the healthcare providers, advocates, lawyers, and staff who have been on the front lines in these past 10 years. People like Jackie Blank, Sarah Alderson, and Liz Wagner of the Center for Reproductive Rights, Monica Edwards at URGE, Dr. Jamila Parrott at Physicians for Reproductive Choice, Amy Williams-Navarro at NARAL, Karen Stone and Nina Sarian at Planned Parenthood, Layla Abulfazi at the National Women's Law Center, and so many across the country, including in Connecticut, Amanda Skinner and Gretchen Raffa at Planned Parenthood, Liz Gustafson at NARAL Pro-Choice, Connecticut. Make no mistake, this fight will continue. The Women's Health Protection Act will pass. It may not be in the next couple of weeks or the couple of months, maybe not even in this session, but it will pass because the conscience of America demands it. That's why referendum have won across the country on this issue. That's why voters went to the polls and showed with their feet where they stand. And that is why we need to fight rulings from the courts, hard-right Republican judges who have declared a war on women. As soon as next week, a judge in Texas may rule that mifepristone, the most common form of abortion care in this country, is illegal, despite 20 years of safe and effective use with approval of the FDA of that drug. A nationwide ban that will affect women in Connecticut if he does it. And we've seen also that Walgreens will not sell or make available mifepristone in the 21 states whose state attorneys general have threatened to sue Walgreens if it makes that drug available. They've succumbed to bullying. They've said to those attorneys general, okay, women lose, you win. I urge consumers to vote with their feet, do their business elsewhere, and show where they stand. I'm proud to be here with my colleagues to continue this fight for the Women's Health Protection Act. Thank you.
Madam President,
Majority Leader.
first I want to thank Senators Murray, Baldwin, Blumenthal, and so many of the others who have spoken on this issue, so vital to our country, to the women of our country, and to all of us in this country. Now, for nearly 50 years, Roe v. Wade safeguarded Americans' fundamental right to choose. But from the moment Roe was decided in 1973, the most extreme elements of the Republican Party made it their mission to reverse Roe and eliminate freedom of choice. Last summer, tragically, that doomsday scenario became true when the MAGA Supreme Court overturned Roe and declared that there was no constitutional right to access abortion. 8 months later, the consequences of the court's decision have been severe. 1 in 3 women have lost abortion access, and over 17 million individuals can no longer access the full range of reproductive care. The MAGA Supreme Court's decision means our children will grow up in a world where they have fewer liberties than previous generations. Today, as I mentioned, Senator Baldwin and Blumenthal, along with many others of us, are reintroducing a salve to this terrible injustice, the Women's Health Protection Act. This legislation only dropped this morning, but Senate Democrats already have a record number of co-sponsors, 49 in total. Let me say that again. The legislation only dropped this morning, but Senate Democrats already have a record number of co-sponsors, 49 in total. This is the most united Senate Democrats have ever been on pro-choice legislation, while Republicans remain hell-bent on eliminating women's choice. After Americans rejected MAGA Republicans' anti-choice agenda last fall, you'd think they would have gotten the message, but they have not. Today, 14 states have enacted near-total abortion bans. Florida Republicans, meanwhile, introduced a bill this week to ban abortions after just 6 weeks, before many women even know they are pregnant. How can you say the Florida bill is anything but cruel, inhumane? And for those who think Republicans' abortion hostility is about states' rights, nearly every Republican in the Senate sponsored and voted in favor of a nationwide abortion ban. That's what this is all about. Republicans deep down want to ban abortions for everyone, everywhere. And as bad as all this is, the worst injustice is that those who suffer most are often low-income Americans, rural Americans, people of color, LGBTQ Americans, particularly the trans community, and especially Black Americans. In fact, Research shows that states with the harshest abortion bans have some of the highest rates of black maternal death, as much as 38% higher in states with abortion restrictions. There's only one word to describe this: shameful. It's a stain, a blot, a blemish on America's soul. So passing the Women's Health Protection Act is the right thing to do for our country. I want to thank all of the senators who helped lead this bill, the women members of our leadership and all of our women senators, and so many others, including Senator Blumenthal, Senator Whitehouse, and many more who worked so hard on this legislation. I will work with them to push this bill forward. I yield the floor.
Madam President.
Senator from Rhode Island.
I'm delighted to follow Leader Schumer, for whom this has been such an important issue and who I am confident will gather our caucus together to be as effective as we can. Today is International Women's Day, but this year it is shadowed by the freedom that women have lost in America to make their own choices and to shape their own lives. A radical Supreme Court, captured by deep-pocketed special interests, has shredded this constitutional right. It is a whole separate story how that happened, how big dark money interests went into back rooms at the Federalist Society, hand-picked Supreme Court justices, put them on the court, spent millions and millions of dollars orchestrating all of that and putting TV ads on behind them, all run through phony front groups, and now instruct them what to do through a whole bunch of other phony front groups, also dark money funded, that go in as amici curiae and present these arguments in orchestrated flotillas to the court. Separate issue, but very unfortunate situation behind this horrible decision. What I want to talk about is how hurtful and harmful this is when things go wrong. Everybody hopes and prays that their pregnancy will be successful and there'll be a healthy birth. But it is not uncommon in a pregnancy for things to go wrong. And when things go wrong, these extreme abortion restrictions put the doctors and the patient into impossible and wrong situations. We hear about doctors who have postponed care until a patient's health or pregnancy complication had deteriorated so much that their life was in actual immediate danger. You could have predicted it, you could have taken the prudent course, but the shadow of these criminal penalties of this assault on women's freedom has made doctors postpone that decision. And it does, in fact, put patients' lives at risk. There are committees that have been set up to determine whether a doctor making a decision about a woman's care should be allowed to proceed. You have to go through the hospital committee because of the risk of liability. Sometimes these things happen fast, and sometimes people feel very privately about them. And the idea this has to go to a committee is both a cause for delay and a huge lack of privacy for the women and the family involved. So in Texas, oncologists have said that they wait for pregnant women with cancer to get sicker before they treat them. Imagine being on the receiving end of that. Some doctors have reported that they are unable to get other professionals to come and assist them with procedures because the other professionals are frightened of liability. And that, too, fouls up the ability of the patient to get care. Even the forensic nurses who care for sexual assault victims. So you're battered and you're raped, and the police respond, and the EMTs respond, and they take you to the emergency room, and there are forensic nurses who provide specified care for sexual assault victims. They do the rape kit. They know how to deal with patients who are still very traumatized, and they usually also provide morning after contraception, right? The woman has been raped. Why would you not do that? Well, now they're anxious about doing that for fear that it will be considered an abortion drug. That woman who's been through that experience deserves far better than to have politics intrude into her care on that terrible night. It's not just me saying this. An emergency physician in Houston, who is the chair of the board of the American College of Emergency Physicians, said, "We're no longer basing our judgment on the clinical needs of the woman. We're basing it on what we understand the legal situation to be." And the president of the American Medical Association says, "This is happening every day, all the time, in these freedom-burdened states." He says, some others have said that these are incredibly rare situations. He says, no, that's not true. This is happening every day, all the time, in these states. I had a grim meeting with a group of OBGYN doctors who practice in Rhode Island, who are hearing from colleagues in states that have been burdened by this freedom being removed from the women in that state, that their professional colleagues, their fellow doctors, are beside themselves at the way this has interfered into their practice, particularly at those most dangerous times when a pregnancy is in trouble and the woman needs the full attention of the doctor and the care that is determined based on her medical needs, not on something that some Republican legislature hobbled together. So really important for us to get together and pass the Women's Health Protection Act. And I want to thank all of those who've shown so much leadership getting us to this day. I yield the floor.
Senator from New Hampshire.
Madam President, I rise today to join Senator Baldwin and Senator Blumenthal and all of my colleagues who are speaking in support of the Women's Health Protection Act. And I want to thank Senator Whitehouse for his eloquence just now in describing the real life and death consequences of the Dobbs decision. I want to thank advocates from Planned Parenthood, NARAL, and other organizations who have been tirelessly pushing for this legislation and standing up and speaking out for reproductive freedom. The grave threat to the health and freedom of women all across our country makes clear that it is more important than ever for senators, regardless of political party, to come together and support this critical legislation. Nothing less than the freedom of American women and the future of our democracy itself depends on us doing so. For more than 2 centuries, each successive generation of Americans has enjoyed more freedoms than the last. By extending the promise of our democracy to all Americans, our country has only become stronger. But the Supreme Court's decision to overturn Roe v. Wade brought that story of progress to an abrupt halt, taking away a fundamental freedom from millions of women, a freedom that most have known for their entire lives. Now, when women across the country raised the alarm following the Supreme Court's decision, there were those who suggested that we were overreacting. They suggested that life for most women would continue as it did before. Well, it has become very, very clear that those who espoused that view were wrong. Since the Supreme Court's decision, legislatures across the country have passed abortion bans into law. Just last week, Wyoming's legislature passed a new law which will ban abortion in all trimesters, in nearly all cases, and would threaten doctors who perform abortions with jail time. Other states have imposed even harsher criminal penalties. This has had a chilling effect on women's health care providers, and countless women can no longer access the reproductive care that they need. Partisan politicians who believe women are incapable of making their own critical health care decisions have made clear that their ultimate goal is to ban abortion in all 50 states. In state houses and here in Washington, these partisan politicians have demonstrated that they are not only committed to dismantling women's health care, but that they do not believe that women have the capacity or conscience to make their own personal decisions. Like many of you, in the last 10 months, I have heard from women at rallies, in letters, and in quiet conversations who are fearful of these attacks on reproductive freedom. The question before this Senate is whether or not we believe that we have an obligation to listen to their voices, whether or not our government should be accountable to the people, including women. What is at stake is the principle that American women are free and equal citizens in our democracy, and that they should be able to chart their own futures. That's why I urge my colleagues from both sides of the aisle to join me in supporting the Women's Health Protection Act, which would once again protect a woman's fundamental freedom in every part of the country. We can't stand idly by as women across America become second-class citizens. We should stand united in the belief that our daughters deserve the same freedoms as everyone else. If we want to ensure that our country remains a place where the promise of our democracy belongs to all, where our daughters are free to make their own choices and reach their fullest potential, where we remain a government by, of, and for the people, then we must listen to American women and support the Women's Health Protection Act. Thank you, Madam President. I yield the floor.
Madam President.
Senator from Washington.
Thank you, Madam President. And I rise with my colleagues today to continue the fight for women in every part of our country to once again be able to make their own health care decisions. Because ever since Republicans succeeded in their decades-long effort to overturn Roe v. Wade and drag our country back a half a century and rip away the right to abortion for women across the country, we have heard one horror story after another. Women left suffering, waiting for the care that they need. Doctors worried that they could face jail time for doing what is best for their patients. Abortion providers who are overwhelmed by patients who are having to wait weeks for limited appointments and travel hundreds of miles for care. Republicans have ushered in a crisis. It is a nightmare for women, for patients, and for doctors alike. And make no mistake, it is a choice extreme Republicans have made. They fought for decades to overturn Roe. They passed the dangerous abortion bans that are causing this pain for women and families. And they are choosing to continue their nonstop efforts to strip women of control over their own bodies. Every day, extreme Republican politicians come out with some new, awful idea to make women's lives worse. Here in Congress, Senate Republicans introduced a national abortion ban last year. This Congress, one of the first bills the Republican House voted on was a federal abortion ban. In just the few months since Roe was overturned, extreme abortion bans have gone into effect in 14 of our states, stripping over 20 million women of reproductive age the ability to get abortion care in their own state. And by the way, transgender and non-binary patients who already face so many challenges getting the health care they need in this country are being harmed by these bans as well. We are talking about truly cruel bans that set bounties for information about anyone that gets an abortion or helps provide one, and bans that even lack exceptions for rape or incest or the life and well-being of the mom. Republican bans have tripled the average travel time for patients to get the abortion care they need since Roe was overturned. And they have been especially challenging for communities that already face barriers for the care they need. Patients with tight budgets who cannot afford to pay for travel and lodging hundreds of miles away from where they live. Black women who already suffer much higher maternal mortality rates. Patients in rural and tribal areas who aren't close to providers to begin with, and patients with disabilities, to just name a few. And now they are going further, seeking to pass new bans to try and get around state court rulings and laws to get around the fact that their own constituents backed the right to abortion in statewide votes just last year. And when extreme Republicans can't convince the American people to get on board with their extreme agenda, they have shown that they will try to force it on women across the country with threats and intimidation and outrageous lawsuits. Extreme Republican attorney generals, for example, are suing the Biden administration because they told pharmacists they can't discriminate against pregnant patients, and because they made it clear when a woman's life is at stake, doctors are required to provide life-saving abortion care. And of course, there's this extreme Republican lawsuit that seeks to take away an important abortion medication for patients nationwide, effectively creating a nationwide ban on the most common way patients get an abortion. 22 Republican attorney generals, and by the way, 67 Republicans right here in Congress, have filed a brief supporting that lawsuit, supporting overriding experts at FDA to take a safe, effective abortion medication away from women nationwide, to take it away from my constituents in Washington State. Madam President, people across the country have already made it crystal clear they will not stand for Republicans' extreme agenda. In fact, last November, abortion rights won in every single place they were on the ballot. Every single place they were on the ballot. And Madam President, Democrats won't stand for Republican attacks either. We are committed right here to being a firewall in the Senate against the House Republicans' extreme attacks on abortions. We refuse to accept a future where our daughters and granddaughters have fewer rights than we did. We refuse to accept that any patient's right to control their own body depends on a state that they live in or the money in their bank account. That's why today Democrats are reintroducing the Women's Health Protection Act, because the Dobbs decision was not the beginning of this fight, and it was not the end, far from it. We have to restore Roe for women in every corner of our country, and that's exactly what this bill does. It follows the Constitution and nearly half a century of precedent and gives patients the right to get an abortion and doctors the right to provide that care, no matter where they are in America. Now, some Republicans want us to just get used to women being forced to stay pregnant, no matter their circumstance, no matter what it means for their health or their family or their hopes for the future. Some Republicans are hoping this will all become normal. Well, I've got one word for them. Never, never will that happen. We will not be quiet. We will not give up. We are going to keep coming back as many times as it takes to end this chaos and return control of women's bodies to women. And I promise every single time we have to come back to this floor to lay bare the horrors that these extreme abortion bans are inflicting on women and patients in this country, we will get louder. So I urge all my Republican colleagues, start listening to the American people. Start acknowledging the pain that these abortion bans are causing. Let's pass this critical bill to make things right. And I can't say that I expect them to listen today, but I can guarantee you, if they don't, we will be back. Thank you, Madam President. I yield the floor.
Senator from Oregon.
Madam President, I rise in strong support of the Women's Health Protection Act. This legislation needs to be a centerpiece in the battle to defend privacy rights in America. This is the third week I've stood on the Senate floor to talk about this extraordinary assault on privacy and bodily independence that's taking place in America. And it started, of course, with the horrendous Dobbs decision. And when that decision came down, Republicans all over America said that this was going to be a matter of states' rights. They weren't telling the truth to the American people. Shortly after the decision, there was a full court press by Republicans at the local level, the state level, and yes, the national level, to claw back the rights of women and deny access to reproductive care. Months after the Dobbs decision, a bill to enact a 6-week abortion ban, to ban abortion before most women even know they're pregnant, was introduced in this body. That was a national ban, Madam President. Every single state. Every single state. So much for states' rights. Anti-abortion activists are not only working Senate Republicans, they're working the court system as well. I call it court washing. It goes way beyond the issue, and I know we've got an expert lawyer in the chair. It goes way beyond the so-called judge shopping that everybody's heard about in the past. It's not simply a matter of looking at a judge's long record of soundly reasoned opinions and hoping for an outcome. Republicans, particularly talking about this case, this one in Amarillo, Texas, Republicans picked him because he was a lifelong right-wing activist who was planted in a district court to deliver the decision they wanted, the verdict that they have been scheming to deliver. We're talking about banning mifepristone nationwide, a drug approved by the Food and Drug Administration. And Madam President, something I care about deeply, as I held the first congressional hearing on the role of the FDA, and particularly mifepristone. It's been safe, it's been effective, it's been the law of the land for years and years. You throw that out, you take away women's independence, and the government puts itself front and center into the exam room and into the private decisions about whether and when to start a family. So, as women grapple with restrictive state laws that take away their right to privacy and threaten their health, they are also facing a crisis of digital privacy and what I call the threat of uterus surveillance. We have long been concerned about location data leaching from phone apps and how ripe for abuse it is. In states where extremists have restricted or banned abortion, the whole issue of women having their personal data weaponized against them is now front and center. Shady data brokers have already tracked women to and from Planned Parenthood health centers, sold their information basically to anybody who's got a credit card. In states where abortion is illegal, anything women say or read online can be used against them. Researching birth control online, updating a period tracking app, even carrying a phone into a doctor's office may become weaponized against you. It could be evidence for the prosecution. Most personal and private data about women's bodies and their health. And just imagine how much worse it could get if more states pass draconian laws or the Republicans get their nationwide ban. So that is why we are here to pass this legislation to ensure that every woman in every state is in a position to make private medical decisions, where that woman is in the driver's seat with respect to their privacy and their independence. To do otherwise is going to keep healthcare providers from doing their jobs. To do otherwise is going to mean more delaying care for women, more bullying pharmacies out of providing medication that are completely legal and FDA approved. And these providers ought to be able to do their jobs based on science. That's what the FDA decision was all about, Madam President. It wasn't a political decision. It wasn't made here on the floor of the United States Senate, having people go back and forth about their opinion. It was an FDA decision based on science. These policies are common sense and they're popular. I'm going to close with just a couple of quick points. Once women lose the ability to make private health care choices about their reproductive health care, I think we ought to make sure everybody understands there will be women who will die. And I think we need to understand that what this is about is whether freedom is going to mean the same thing for women as it does for men. Women do not have the same privacy rights right now. They don't have the same freedom. If women are subjected to uterus surveillance, they don't have true freedom. If Republican politicians dictate what goes on in an exam room, they don't have true freedom. If women can't control their own bodies, make their own decisions about when and whether to get pregnant, they don't have true freedom. And if women are forced to give birth, and in some cases Republicans want to force women to give birth even after cases of rape and incest, those women do not have true freedom. So if there is one word that this debate is all about, for women, what is at stake with that one word is freedom. And our legislation ensures they'll have it. I urge colleagues to support it. President, I yield the floor.
Mr. President.
Senator from Hawaii.
Mr. President, I rise today on International Women's Day to urge my Republican colleagues to join us in protecting our individual rights and freedoms and support the Women's Health Protection Act. You have heard from a lot of us on the floor today, and we're going to repeat certain things, but these are things that bears repeating because this issue of abortion is all about who gets to decide. Is it the individual or a bunch of politicians? You can see where I'm coming from. So when the right-wing, ideologically driven Supreme Court overturned nearly 50 years of precedent in abolishing an individual's right to get an abortion, that was just the beginning. The Dobbs decision opened the doors for extremist Republicans who have made clear that they will stop at nothing to control our bodies. It hasn't even been a year since the Supreme Court upended our right to bodily autonomy. And already, abortion is entirely banned in 12 states, meaning more than 20% of the US population live in states where abortion is illegal. 21 states have enacted 36 bills to restrict or ban abortion. And 12 state constitutional amendments have been proposed to limit abortion access. And just this week, Florida Republicans filed a 6-week abortion ban. 6 weeks before many women are even aware that they are pregnant. After the Dobbs decision, Republicans claimed abortion would be dealt with in the states as states' rights. This is what we in Hawaii would call a shibai argument. Clearly, abortion has never been about states' rights. So their unrelenting efforts to limit bodily autonomy is about taking away the very individual rights and freedoms that Republicans claim to care so much about. Beyond state legislatures, Republicans in the Senate have introduced a nationwide abortion ban. Any day now, we are waiting for one extremist Trump-appointed federal judge in Texas to decide whether to institute a nationwide ban on mifepristone, the safe and effective medication that Americans have relied on for more than 20 years, for more than 2 decades, and that accounts for more than half of the abortions in our country. Regardless of this decision in Texas, after threats from GOP attorneys general from 20 conservative states, Walgreens stated they will no longer dispense medication abortion pills in numerous states, including states where medical abortion remains legal. Although they now appear to be walking that back after provoking a public outcry. What's next? Banning contraception? There are even Republican state lawmakers introducing bills to allow the death penalty for women who have abortions. There is no end to what extremist Republicans will do to control our bodies. Whether you live in states like Hawaii, California, or New York, or states where Republican legislatures have already passed laws, our freedom is at risk. Our bodily autonomy is at risk. For pregnant people across the country, that means their health and even their lives are at stake. Pregnancies carry many risks, and the U.S. already has the highest maternal mortality rate of any developed country. Unbelievable that a country like the United States has the highest maternal rates in the world. Now, these risks are even greater for women of color, women with disabilities, and transgender and gender nonconforming individuals. People will die without access to safe, legal abortions. A recent study found if Republicans institute a nationwide abortion ban, maternal deaths will rise by 24% across the country. So today, I urge my colleagues to stop pandering to the political extremism in our country and join us in passing the Women's Health Protection Act to codify the right to an abortion in federal law and protect all people across the country. Mr. President, I yield back.
Mr. President.
Senator from Michigan.
Thank you, Mr. President. I am really proud to join today with my colleagues to speak on behalf of American women, the fundamental rights of all pregnant persons, and our freedom to make our own health care decisions. Thanks to a radically conservative Supreme Court, reproductive freedom is no longer a constitutional right in the United States for any American. Roe v. Wade protected our freedoms for 50 years until it didn't. And now, today's young women have fewer freedoms than their mothers and their grandmothers ever did. And we're furious. Want to know how furious? In Michigan, we turned our anger into action. In November, we had the largest voter turnout for a midterm election ever. And one of the measures on the ballot enshrined a right to reproductive freedom in our state constitution. It passed by a strong 13-point margin because Michiganders understand that health decisions should be made by individual people, not by judges, not by politicians. Unfortunately, a lot of folks didn't get the message. Republicans in Congress have pushed for a nationwide abortion ban. State legislatures across the country are making it harder and harder for people in their states to receive reproductive care. 24 states have already banned abortion, or probably will soon. And any day now, a federal judge, one man in Texas, let me repeat that, one man in Texas is expected to hand down a ruling that could ban a medication that's been used to safely end pregnancies for 23 years. That decision would prevent patients from getting the health care they need, even in states where abortion is legal. That's why it is so incredibly important that we pass a law that says once and for all that women in America have the freedom to make our own health care decisions. And that's just what the Women's Health Protection Act will do. And I'm very proud to join my colleagues in introducing this bill. It will protect all Americans from state laws that limit access to abortion services. Right now, your freedom to make your own health care decision depends on the zip code you happen to live in. And that's simply wrong. Women in Michigan and Mississippi and Montana all deserve to make decisions about our own health care, our own lives, not extreme Republican lawmakers, not extreme members of the Supreme Court, not one extreme judge in Texas. It is critical we pass the Women's Health Protection Act now. Our freedom depends on it. And let's be clear, we will continue to fight until our reproductive freedom as Americans is restored. I yield the floor, Mr. President.
Senator from Nevada.
Thank you, Mr. President. I've had the opportunity now to listen to all of my colleagues as they rightfully come to the floor here to really talk about the erosion of women's rights in this country by the far right extreme. And I have to thank Senators Baldwin and Blumenthal and so many of my colleagues, Pat Murray, and so many who have been on the forefront of protecting women's rights and freedoms. And let's not mistake this. This is about women's freedom. That's what this is about. It's been less than a year since the Supreme Court overturned Roe versus Wade, and it's been a dark time for women in America since then. Because by dismissing 50 years of precedent that protected women's freedom, the Supreme Court emboldened far-right Republicans to go after women's rights in increasingly extreme ways. One of the first things some of these Republican leaders did in Congress after the Dobbs decision was work on legislation to ban abortion nationwide. And until they can pass that legislation denying states their ability to keep abortion legal, they will continue their attacks on reproductive freedoms and make it as difficult as possible for women to access essential reproductive health care. In Texas, Arizona, Wisconsin, and other states with strict abortion bans, doctors who provide women with reproductive care could be prosecuted, heavily fined, or imprisoned, and in some cases, all three. These states have threatened to revoke providers' medical licenses, putting their politics above what's best for patient health. And for women, confusion and fear over abortion bans has led to denied access to necessary and potentially life-saving reproductive care. Imagine the distress, the burden these women and their families carry. Pregnancy decisions are deeply personal. It's not a legal debate up for discussion in the courts. We must do everything we can to ensure that women have the tools that they need so they can decide what's best for their lives, for their health, and for their families. Since the court overturned Roe, women have begun traveling, as you've heard today, to pro-choice states like Nevada for the abortion care they need. But that's not enough, because anti-choice policymakers are working on ways to take that freedom away. States' rights isn't enough. Their latest attack on women's rights is through a lawsuit to restrict nationwide access to the abortion pill, even for women in states where medication abortion is one of the few legal options left. Extremist Republicans' war on reproductive freedom didn't stop with overturning Roe. It didn't stop with punishing doctors, and it won't stop with going after medication abortion. Let's get one thing clear. For the far right, this is about controlling women. Well, I trust women, and so do a majority of Americans, including Nevadans. Nearly 2/3 of Americans believe women should have the right to make their own choices about their reproductive care. And I stand with them. That's why I am proud to join my colleagues today to reintroduce the Women's Health Protection Act. As you've heard, this bill defends women against the extreme politicians who are working to strip away those rights, guaranteeing that women can seek the vital reproductive care they need without having to answer to the government. Under this bill, women would see an end to abortion bans and burdensome restrictions to accessing abortion. Women would be able to get the health care that they need without being subjected to medically unnecessary ultrasounds, excessive waiting periods, and other obstacles that far-right politicians have put in their path. Women and their families would be able to plan for their futures on their own terms. The alternative is to watch a minority of extremists continue to strip away women's rights across the country. We must protect a woman's right to choose and pass the Women's Health Protection Act. And I will say one final thing, and I would hope my colleagues on the other side would listen to this. We've heard conversation about the impact that this issue has had on this election, this past election cycle. I am proof. I am back here because not just Democrats, but Republicans And independents, nonpartisans in my state, care about this issue. They care about the rights of women and their freedom to make this decision. And a majority of Americans do as well. So that's why it is important for all of my colleagues. I don't care what aisle you sit in. I don't care what party you are or you're not a party. The goal here is when we come to this Congress, when we stand here together and we try to solve the problems that matter to this country, we are listening to the American people. And we are not letting a minority determine. And we are not about taking away the freedoms and rights of people in this country, including women, and turning them into second-class citizens. That's not who we are. And so I would invite my colleagues at all times, I don't care where you are, what party you stand with, where you are, stand with women in this country. This is such an important issue. Pay attention to the American public, what's at stake here, and I would ask you to support us with the Women's Health Protection Act. Thank you, and I yield the floor.